Very good evening to all of you and welcome to the last day of workshop. In today's session, we will learn about various modalities for dissemination of our research studies and various scientific inquiries. We conduct research to solve problems encountered across various domains of healthcare. Details and outcomes of our scientific inquiries needs to be disseminated to our peers in particular and public in general. Scientific community evaluates our work and some of them also conduct replication studies. Replication is one of the key principles which builds confidence in science. Our ultimate goal is to translate our findings from knowledge to solutions of the problems for which we have conducted the scientific investigation. There are many ways to disseminate our research. It may be submission of thesis or dissertation as a part of curriculum or submission of a report as a regulatory requirement by funding agency. Most common method used is publication in a scientific journal. Nowadays, media briefings are also happening and researchers also prefer to use social media and academic social networks to disseminate research. Today, we will discuss a bit about all these modalities. Scientific journals play the most critical role in dissemination of scientific inquiries. And since now thousands of journals are there is something called as International Committee of Medical Journal Editors, which has laid down guidelines regarding submission of manuscripts. Link is provided on this slide to these guidelines, and you will note the key principles given in this website, like what should be there on title page and how abstract should be written, what should be the contents of introduction, how context and background is important to describe, then details on methods. Always remember, methods is the heart of any scientific inquiry. We should describe methods as elaborate as possible, and those are the things which are evaluated for robustness. So methods should have many subheadings as per the journal guidelines obviously, but there are standard subheadings as well. And then how statistics analysis was conducted, that has to be mentioned, and we have to follow the guidelines for describing the results as well. And you can go through these guidelines on your own. Obviously, our today's session is not about how to write the research paper. It is in entirety a different workshop, right? So at your leisure time, you can go through. Considering the growth in number of journals and ever-growing pool of researchers and everybody publishing in various journals, it becomes very difficult to navigate, and there are difficulties in finding out accurate, complete and transparent reporting of the health research. Therefore, to make it sure that every researcher reports it accurately, completely and in a transparent manner, so that reproducibility concept is supported and studies are useful, the researchers across the globe came together and found something called as Equator Network, which has its objective or vision as enhancing the quality and transparency of the health research. And they have developed certain checklist, and this checklist can also guide you in writing your research. One of the checklists which will be frequently used by you is Standards for Reporting Diagnostic Accuracy, popularly known as STARD checklist. This checklist details about which things should be there in various components of the manuscript. Like it asks us to identify whether it is a diagnostic accuracy study or not in the abstract or in the title. For abstract as well, there is a guideline called as starred for abstract. You can see that. Then it tells us that in introduction, there has to be clinical background, scientific background, and what are the intended roles of the index test, which were the study objectives, what was the study hypothesis, whether data collection was done retrospectively or it is a prospective data collection, what were the eligibility criteria, what was the setting in which study was conducted. So these things need to be there to ensure the validity of the study. And you can see methods. I have told you that methods are heart of the any study. Methods need to be described elaborately. Description of the test method needs to be in depth. This is necessary so that other researchers can replicate whatever you have done. That is, your index test and reference test should be able to be replicable. So you should describe how you have developed that test if you have done any novel thing in designing an index standard. Then, if our test uses some cutoffs for a numerical quantity, how those were chosen, what was the rationale for positive cutoff. One thing which we have discussed during sample size day lecture was blinding of test readers for index test and reference test. If it is applicable, that should be described in detail. And analysis of the diagnostic accuracy study need to be described as well. And what has happened to missing data, how it was handled, if some tests were failed, if some tests were indeterminate, how you have dealt with, that needs to be mentioned. And also intended sample size calculation statement need to be inculcated in your manuscript. After describing methods, next logical step is to describe results. For description of results, a flow diagram is usually preferred. I will show you that flow diagram in the next slide. We have to give baseline demographic and clinical characteristics of the participant. If there is any severity gradient in the disease, that needs to be described. And if some intervention has been done between index test and reference standard, that also needs to be mentioned. Our key results are described by cross-tabulating results of the index test with results of the reference standard. Reference standard is popularly known as gold standard as well. So we estimate parameters of diagnostic accuracy such as sensitivity, specificity, and other parameters. We are not supposed to only give point estimate, that is sensitivity in percentage. It is expected that we also describe its precision. So we calculate confidence interval. There are online calculators for that as well. One such calculator is openep.com. Once we have described the key performance parameters, we have to also mention if there was any adverse event in performing index or the reference standard. In discussion section, we explain our results, we compare and contrast our results with the existing or prior studies, right? And then we have to write what things we wanted to do or what would have been the ideal study and how our study is limited. So limitation description is very important in any research paper. Obviously, your paper should conclude with implications for the practice. This is how you summarize your results of entire study in one diagram. We start from showing number of potentially eligible participants, out of which how many were eligible, out of which how many got index test, out of the results of index test as positive, negative or inconclusive, how many got reference standard test, and then what were the ultimate diagnosis or final diagnosis. So this diagram summarizes entire study. It is also known as starred diagram. Now we have seen the reporting guidelines and you have completed your manuscript. you can check that manuscript with respect to the guidelines and whether all the contents as per the International Committee of Medical Journal Editors recommendations, as well as the journal's instruction, as well as the any standard guidelines are included or not. You can do it manually, but still there is a scope that we may have left something. So now we can get benefit of living in era of artificial intelligence. These are the two tools which will help you to check automatically if we have included all the concern statements. So these tools are for technical checking, as well as one of the tool is for language checking. This homepage will open. This platform is basically designed for journal publishers, but we as a researchers can also benefit from it. We can submit our manuscript for technical checks. For that, you need to upload the manuscript and answer some questions, and you will get an email with a password to check feedback. On their website they have shown an example of the feedback, right? So you can see this manuscript was automatically checked, and this is a feedback for editor. There can be feedback for author as well. If we submit, we get the feedback, right? Here you can see you are viewing as an editor. I will click on author instead, and it will show you automated checks, and it is very useful for checking whether your prepared manuscript or draft of the manuscript compiles with all the checklist items which needs to be completed. Like it mentions, you need to write about reporting checklist, you need to write about ethical approval, your abstract must use correct subheadings, etc., etc. Whatever lacunae are there, it will detect, and in matter of 5 minutes or so you will get it free of cost, so you can keep using it. Our PubSure platform made available by Researcher Life. They also provide two tiers of services. One is free and another is pro. So they check your manuscript for technical submission items as well as language, and give you the report. Register and upload your manuscript, you will get a light report. Report will be something like this. They will give score for language quality, technical checks, they will provide keywords and summaries, and also they will provide journal recommendation. Here is one of the report which is uploaded on their website as a sample report. You can see they show different errors in grammar, in readability, in vocabulary, and they give you the suggestions. So if you have the money, you can go for pro edition, but even if you don't have money, you can get at least some technical checks done, and they are free of the cost. Like you can see here, these are the checks: author details, inclusive language, structural completeness, copyright declaration. So what happens is, once you write manuscript, and even if you check manually, there are certain things which we miss out. So this can help out quickly and save our time. It also provides keywords and summaries. It extracts keywords from your manuscript, and journal recommendations are also given. So this is a fantastic facility at no cost. And if you pay for this, then you will be eligible to make changes, because they will provide you suggestions in track change mode, and you can just accept the change and again resubmit the manuscript or submit the. Up till now, we have talked about publishing in a journal, we have talked about various reporting formats and some AI based tools. Now we will move forward. You must have seen articles from preprints. What are preprints? Preprints are nothing but draft manuscripts completed with all the respects just before submission to the formal journal. You push them on preprint server. Preprint servers are for distribution of your scientific inquiries with a purpose to facilitate early dissemination, to provide time stamping, and to enhance transparency in research. So, what preprint server basically does is it gives you an opportunity to disseminate your results early so that time consumed in peer review doesn't become obstacle in dissemination. Why I said that it increases transparency? Because before peer review, whatever is the draft, you have published it in open domain, right? So you will do it more stringently because you know that it is in public domain and open to comments. So there are variety of preprint servers, and now most of the publishers are providing opportunity for preprint servers. So common preprint servers are medRxiv, BioArchive, even PLOS has preprint, MDPI has preprint. You can use any of the services. The next big question we have while writing the draft or after completion of draft of the manuscript is where to publish. What is the suitable journal? So, names of such suitable journal can be suggested by experts or peers who are working in the field. You yourself can find certain journals in the references which you have cited. Simpler way is to search keywords of your article in the PubMed or Google Scholar or any search engine, which will give you list of the articles, and from those articles you can retrieve which journals used to publish such articles. And then again, to leverage the age of technology, we can use some online journal suggesters or finders. I will show you some of the online journal suggesters or finders in next few slides. Here you can see the names of the tool and popular publishers which provide tool for their publications. So you can see that all the popular publishers have given a journal finder or suggester tool on their website, where some of them expect us to copy and paste abstract and some expect full article as well, and they suggest what are the popular journals among their publication. So these are publication specific finders. These are some generic finders. We will see demonstration of the first one, that is journal author name estimator. I will show you how to search journals, suitable journals for publication by using this tool. There are a few other tools as well. These are again few additional tools to find out suitable journals. Even these Clarivate analytics provide something called as Manuscript Matcher. This is available free of cost, where you have to upload either abstract or manuscript and it will suggest suitable journals. Link is provided. You have to register and submit, and then you will get the feedback. That is also a useful journal suggester or manuscript matcher. I will demonstrate you one of the journal finder, that is GEN, journal author name estimator. Here if we type our title or abstract and search, then we can find appropriate journals for publication. So what we will do is we will take a already published article and put its abstract in this journal author name estimator. So I will again go to galactomannan detection for invasive aspergillosis, and this is a published article. What I am doing is I am just copying its abstract and pasting in the journal author name estimator. So I will paste it here and I will hit find journals button. So it will give us the list of potential journals which we can consider. It also tags with Medline indexing, PubMed central indexing and all. So if you have written your manuscript and abstract and want to find potential journals by using such a tools, this can be an option. Thousands of journals are now available for publication. You might have been getting emails asking for your submissions. You might have presented a paper in some conference or poster in some conference, and you might have received an email that we read that with interest and we would like to publish it. Somebody might be inviting your article for the last few articles are short for publication or something like that. And you are also sort of pressurized to publish because you live in something called as publish or perish era. So that becomes challenging to identify which journal is the right one and which is predatory. What does predatory means? Basically, predatory means they will not do any kind of peer review, they will not check for the quality, and they will just take some money and publish your article. And this publishing in such kind of journals is loss to your academic reputation. So you must have tools to identify such journals. There are these two websites which give list of predatory journals, and
You've done your research and are ready to publish. Sharing your results with the world is key to the progress of your discipline and to your career. Publishing your work with an untrustworthy journal has the potential to damage your career. With the number of journals growing at around 3.5% annually, and almost 1,000 new journals launching in 2014 alone, how can you choose a trusted journal for your research? Think, check, submit. Before you decide, step 1. Think. Can I trust this journal with my research? Do I need more information before I can decide that this is a trusted journal? Step 2. Check. Does the journal publish research that you would read yourself? Can you tell which organisation publishes the journal? Can you contact them easily if you need to? Does the journal have editorial policies in place? And do they conduct appropriate peer review? Does it charge publication fees? And are they clear about how much they cost? Do you know the names or reputations of any of the editorial board members? Are articles in the journal indexed in any of the services that you use? Step 3. If you can answer yes to most of these questions, then submit. By following these 3 steps, you can identify which journals will reliably publish your work and make an impact in your field. When you finish your next article, remember to think, check, then submit. Check the website for more tips to help you find a trusted journal for your work.